Acid reflux after 60, why heartburn gets worse with age. Do you feel burning in your chest after meals, wake up coughing at night, bitter taste in the back of your throat? If you're over 60, you are definitely not alone. Today, we're talking about GERD, also known as acid reflux, why it becomes more common as we age, what's actually happening inside the body, and most importantly, what you can do to feel better naturally and safely. If you're over 60 and struggling with digestive issues like reflux, constipation, bloating, or stomach discomfort, you're in the right place. I'm Courtney, a GI nurse practitioner, and each week I break down common digestive problems in a way that's easy to understand and actually helpful. GERD. It's an acronym that stands for gastroesophageal reflux disease. That's a long medical phrase that basically means stomach contents are flowing backward into the esophagus and causing symptoms or damage. The esophagus is the tube that carries food from your mouth down to your stomach. Normally, there's a muscle at the bottom called the lower esophageal sphincter, or LES for short. Think of it like a little valve or trap door. When working properly, it opens to let food into the stomach and then closes tightly to keep stomach acid where it belongs. But in GERD, that valve becomes weak or relaxes when it shouldn't. That allows acid and stomach contents to flow back upward into the esophagus. And unlike the stomach, the esophagus is not designed to handle acid. That's what causes symptoms like heartburn, sour or bitter taste, regurgitation, chronic cough, hoarseness, frequent throat clearing, trouble sleeping, sometimes even chest pain. A lot of people are surprised to learn GERD doesn't always feel like classic heartburn. For older adults especially, symptoms can show up as chronic cough, excess mucus, voice changes, repeated pneumonia, feeling like food sticks, or worsening asthma symptoms. Let's talk about what's actually happening physically. Your stomach naturally produces acid to help digest food. That acid is powerful. It's supposed to stay in the stomach though, but several things can allow acid to travel upward. First, weakening of the lower esophageal sphincter. Over time, the valve between the esophagus and stomach can lose strength. Second, hiatal hernia. This becomes more common with aging. Part of the stomach slides upward through the diaphragm, making reflux much easier. Slower stomach emptying. As we age, digestion often slows down. Food and acids stay in the stomach longer, increasing pressure and reflux. Reduced saliva production. Saliva actually helps neutralize acid. Many medications and aging itself reduce saliva, so acid lingers longer in the esophagus. Decreased esophageal movement. The esophagus becomes less efficient at clearing acid back down into the stomach, so the acid stays there longer, causing more irritation. And over many years, untreated reflux can lead to inflammation, ulcers, narrowing of the esophagus, and in some people, a condition called Barrett's esophagus, which can increase cancer risk. This is the part that I really want older adults and caregivers to understand. GERD is not just about spicy food. Aging changes the entire digestive system. Here are some major reasons symptoms worsen after 60. Medications. Many common medications relax the lower esophageal sphincter or irritate the esophagus. Examples include some blood pressure medications, NSAIDs like ibuprofen, certain anxiety medications, some sleep medications, and osteoporosis medications. Weight changes. Even small amounts of abdominal weight increase pressure on the stomach. That pressure pushes acid upward. Reduced mobility. Sitting or lying down more after meals can worsen reflux. Sleep position. Nighttime reflux becomes much more common with age. Lying flat allows acid to travel upward more easily. Sensitivity changes. Some older adults actually feel less heartburn despite having more damage occurring internally. That means severe reflux can sometimes go unnoticed. Now, the good news. Many people can dramatically improve GERD symptoms with simple daily habits. Avoid lying down after eating. This is one of the biggest things. Try to stay upright for at least 2 to 3 hours after meals. Gravity helps keep acid down. Eat smaller meals. Large meals stretch the stomach and increase pressure. Smaller meals are usually much better tolerated. Identify trigger foods. Common trigger foods include fried foods, tomato products, chocolate, peppermint, alcohol, coffee, carbonated drinks, and spicy foods. But triggers are different for everyone. Raise the head of the bed. Not just extra pillows, actually elevate the head of the bed about 6 to 8 inches. This can significantly reduce nighttime reflux. Maintain a healthy weight. Even modest weight loss can improve symptoms. Stop smoking. Smoking weakens the lower esophageal sphincter. Talk to your provider about medications. Some people benefit from medicines like antacids, H2 blockers, proton pump inhibitors, also called PPIs, but these medications should be used appropriately and under medical guidance, especially long term. Now, this is very important. You should talk to a healthcare provider if you have trouble swallowing, food getting stuck, vomiting blood, black stools, unintentional weight loss, persistent vomiting, new symptoms after age 60, or symptoms that continue despite treatment. And remember, chest pain should always be evaluated urgently first. GERD is incredibly common, especially as we age, but understanding why it happens gives you the power to manage it better. If this video helped you understand your symptoms, make sure to subscribe, because next week we're talking about another very common digestive issue in adults over 60. And if there's a GI topic you'd like explained in simple terms, leave it in the comments below. Thank you for being here. Take care of yourself and those you love, and I'll see you next time.